Hello, good crowd. As we wrap up the final 50 episodes of the Your Mark on the World show, I'm excited to bring you Dr. Winnie Mpanju-Shumbusho. She is the co-chair of the Lancet Commission on Malaria Eradication. We're talking about eradicating malaria today. Such an important topic. You had no idea there are 220 million cases of malaria every year. You stick around. You don't want to miss this episode.
Welcome to the Your Mark on the World show with your champion of social good, Devin D. Thorpe.
Our sponsor, Johnson & Johnson, matches most individual donations up to $250 at caringcrowd.org. Dr. Winnie, welcome to the show.
Thank you, Devin. Thank you for having me.
Well, we're thrilled to have you and so grateful that you would make the time to join us for this conversation. Such an important conversation. I don't think most people are aware of how pervasive malaria is in the world. Tell us a little bit about how it affects life in countries that are affected by malaria.
Thank you, Devin. Malaria, as you know, is the most devastating disease and has been around for the history of mankind. It has probably killed more children globally than any other disease, and continues to cause a lot of mortality and debilitation, but also rob families and communities of their livelihoods and potential to achieve what the human potential can be.
Yeah, it isn't just the lives that are lost to the disease. There are, 400,000 or 500,000 people die every year, but 200 million or 300 million people get malaria every year. It's just horrible.
Yes, absolutely. And the sad part is that it doesn't need to be so. As you know, malaria was in every country in the world, but take, for example, the United States eliminated malaria back in 1952, before you and I were born. And yet today in countries, many countries, especially in Africa, children are still dying in hundreds of thousands from malaria. Hospital wards are overcrowded with malaria patients, and children don't achieve their potential because of repeated malaria infections in their childhood. And we know that we have the tools to prevent it, diagnose it, and treat it. But the situation remains as I've just described it.
In some countries, malaria remains a huge poverty tax, right? It's like a tax on being poor, of all the horrible things. It's just a double whammy. You've spent your career fighting malaria and other diseases. Tell us a little bit about some of the work you've done in the past for the WHO and elsewhere to bring an end to malaria.
Thank you, Devin. When I began working as a pediatrician in the early 80s, we had hospital wards overcrowded with malaria patients. Most of these children would come in a very grave situation, often unconscious, and we lost many children from this disease. In my mind, I was asking myself, what is it that we can do to make sure that we bring an end to this situation? And therefore, I found it necessary to link the actions at the hospital level to the actions in the community level, but at the same time at the policy-making level. Therefore, my work in WHO was to try and see how we can address the situation on the ground by ensuring that the policies and the programs that we are trying to formulate to deal with this disease are realistic to address the situation on the ground. And therefore, for me, my path has taken the entire route from working at the community level to working at the hospital level, but also working at the global level formulating policy and advising programs, but also mobilizing the resources that we need to tackle this enemy once and for all.
It's great and important work that you're doing. As you look forward in time, what do you think the key weapons are that we have now and can develop to bring an end to malaria quickly?
So thanks for that question, Devin. This was the essence of our work in the Lancet Commission on Malaria Eradication, to look at the evidence that exists, bring together, mobilize opinions and the science, the research, the policy making, to see what is it that we can do to move one step closer to eradication. Because we know that in many countries, if we don't step up the game, we will never get rid of malaria. Yes, we have come a long way to reduce the disease burden, but if we don't step up the game by way of ensuring the management of programs is improved, we use real-time data to inform these programs and make sure that we address the hotspots and tackle the targets where the disease is still rampant, whereas in some other places it's much better. But at the same time, make sure that we mobilize the resources that are needed to tackle this disease and generate new tools to step up the fight, so that we are not just talking of controlling malaria, but setting a target to actually end this disease once and for all.
It seems to me that eradicating malaria will require a highly effective vaccine. Am I seeing that wrong?
You're right, Devin, but a vaccine will need to be part of the tool, one of the tools that we have. If you look at where we've been successful, it has been a combination of interventions, making sure that we tackle the vector control, that we improve the diagnosis, especially rapid diagnosis to diagnose malaria real time, but also that the treatment that we have is effective to deal with the malaria parasites. And as you know, we've been battling a constant battle with malaria resistance, both for the parasites, but also for the vector. That is why we are saying, if we don't step up the game and end malaria for good, we will forever be constantly trying to be ahead of the game vis-a-vis the resistance. Yeah. At the same time, we have another huge responsibility to make sure that the resources that are needed to turn back the tide of malaria once and for all are available. Currently, the resourcing that is used in malaria is falling short of making sure that we can actually go full throttle to eradicate the disease. But if we are able to mobilize, for example, 2 billion more per year, most of these from domestic sources in the countries affected, and 0.5 billion from external sources, we can actually move much closer towards eradication of the disease. At the same time, we need to do better in terms of partnering with the private sector, because in most of these countries, patients go to private facilities to seek care, but there is no stewardship from governments to make sure that the right tools are being used, correct diagnosis is happening, and that the statistics of malaria is being captured in those facilities as well. So we need to partner with the private sector, both in terms of data, but harnessing also management to ensure that we can optimize on what they do better, and also optimize on what the public sector does better.
Despite the alarming statistics around malaria that I mentioned at the beginning of our discussion, progress really is being made. There are fewer people contracting malaria now than in the past, and fewer people are dying of malaria than in the past. What are the keys that have brought us this far? What are the best and most effective tools that we have right now?
I think in the last 10 years, we have done better in terms of using tools like personal protection tools, such
Nets?
bed nets, but also rapid diagnosis to make sure that patients with malaria are diagnosed in time so that effective treatment is effected, but also effective treatment by way of artemisinin combination therapy. At the same time, making sure that the environmental aspects of malaria control are being paid attention to, because if you didn't have breeding sites, there would be no mosquitoes to deal with. Hand in hand with that is health-seeking behavior of the community, and having communities as key partners in making sure that the interventions are applied to scale and seeing their role in the entire fight against malaria. So the combination of those plus the constant attempts to have new tools. Like you said, we now have a malaria candidate vaccine under trial. So all those have brought us to a reasonable level of expectation that if we scale them up to 80% coverage, for example, by 2030, as is stated in the global technical strategy, we can make strong headway towards ending the disease for good. But we will not reach the eradication part if we don't bring on board new tools. The current tools we have are not enough to finish the job. So looking at the pipelines and seeing some of the products in the pipeline, both in terms of treatment and insecticides and diagnostics, that is an additional factor that will help us to move towards eradication.
Well, I sure hope we can see the kind of success over the next 10 years that we've seen in polio eradication in really the 20th century, right? We saw polio cases go in the last 15 years of the 20th century from about 350,000 a year to about 10,000 a year. If we could see that kind of drop over the next decade, which would be conceivable, it would be a radical step forward, wouldn't it?
Absolutely, Devin, and it is doable if we were able to step up, and attain better management of the programs, scale up the interventions, and this is why you need program management to be improved drastically, because right now, if you look at countries which have endemicity of malaria, oftentimes the national program is trying to do everything. The local health workers are not properly supervised. They are not accountable to the data to make sure that this data, real-time data, informs resource allocation and so on and so forth. And the supervision on the ground is not there. So there is a dichotomy between the national efforts at national level and what happens at the community and primary health care level. So attaining malaria eradication would mean that you push hard for universal health coverage, because if you are successful in getting malaria interventions coverage to the level where we need to be, you will have done a lot towards other aspects of the health systems. And therefore, this is why we are saying malaria can be a catalyst as to how soon and how much we can impact on universal health coverage and the sustainable development goals.
Excellent. Well, Dr. Winnie, you have been working at this for so long, so hard. What are you most proud of having accomplished?
That's a very interesting question, Devin. Thank you for asking that. But what I can say is that when I started working in the pediatric field, the number of deaths that were happening from malaria, but also other, infectious diseases, HIV, AIDS, tuberculosis, were horrendous. And I see that we've come a long way by working together, not just at the level, the global level or the national level or the community level, but collectively connecting the dots, being able to bring together the policymakers, the scientists, the program planners, the community leaders to address these problems, for me, has been something which I shall always be thankful for, because we have seen the results of these efforts. But also I can say being able to bring people from all walks of life to address these life-threatening conditions so that they see their role. Every member of society wants to see healthy children. Every member of society wants to feel that they have contributed something. And oftentimes when they are made to understand what is it that they can do, they often come forward and contribute whatever it is that they can contribute. So being able to have been part of those efforts, for me, is something I'll always be thankful for.
Dr. Winnie, what is your superpower?
That's an interesting question. I'm not sure what superpower is, Devin, but what I can say is it's the ability to be able to connect with people from all walks of life, to be able to deliver a message to them that allows them to see their role in whatever efforts we're trying, to involve them. But also being able to simplify and demystify science for the ordinary person. I'm perfectly comfortable sitting under a tree in a village discussing malaria as I am sitting in the World Health Assembly talking about malaria. So for me, those are, I find key ingredients to being successful in the battle against these deadly diseases.
Excellent. Well, Dr. Winnie, thank you so much for taking the time to be with us today. I know you are very busy, but before you go, do you take just a minute and tell people how they can learn more about your work in malaria and how they can connect with you personally?
Thank you so much for having me, Devin. And by way of communication, I'm reachable both by email, wmpanju@gmail.com. I can also be reached through the RBM Partnership to End Malaria. We have a website. This is a platform where partners come together and contribute to the efforts towards malaria, to ending malaria for good. But also I'm reachable on LinkedIn and Facebook and Twitter.
Excellent. Well, it is so wonderful to connect with you. Thank you so much for your great work. We wish you every success in eradicating malaria soon.
Thank you so much, Devin, and thank you for taking the time. And I know also you are a key player in our efforts to eradicate malaria once and for all. Thank you.
Thank you. Now, let's do some good.
Yes.
At Caring Crowd, we believe everyone has the power to make a difference. Through our crowdfunding platform for community health, we empower passionate people to drive real change. Whether you work for a nonprofit organization, volunteer, or want to get involved for the first time, you can post a campaign on Caring Crowd. Join us, because caring is where change begins.
Thanks for tuning in to the Your Mark on the World show. the Social Impact Podcast. Please subscribe via YouTube, iTunes, Google Play, Stitcher, or Spotify.